what's happened here is that Julie's been wearing a partial denture to replace 2 missing teeth over here. She's increasingly getting fed up with this denture. I think she previously had a bridge that's failed, and she's looking for a replacement just for those 2 teeth. You can see up here we've lost some gum and the bone supporting under that. But the biggest thing that this image reveals is that these lower teeth are a little bit worn, and Julie is missing back teeth on the left hand side. So we ended up in this situation where we've got these missing teeth, we've got back teeth that are missing as well, and the patient has been referred in only to have these front 2 teeth missing. So I decided, let's take a scan and let's find out what's going on. So you can see over here that the patient has got 1, 2, 3, 4, 5, 6 teeth, 5 of which have got large restorations on them. There's kind of a hidden little root over there that's never been looked at or never been mentioned. But we've got teeth that have got a reasonable prognosis, but not very many of them, and no support at the back. So all the load and all the pressure is on at the front, which I think, in my opinion, is the main reason why that bridge failed. When we looked further into this area, the bone was really, really thin. I think we're talking about 2, maybe 3 millimeters. So if your average implant has a diameter of, let's say, 4 millimeters, we cannot be putting implants into 3 millimeter bone. So then this sparked up a conversation between Julie and I, where we start talking about the options. What can we do? And I started by saying to Julie, look, we can put in implants at the front. My personal opinion is, unless we do something at the back to help support and protect the teeth at the front, personally, I don't think it's a good move. So we started talking and we said, look, there's not enough bone at the front. If we do want to place implants at the front, we will have to graft in a way, either a block graft or like a Quraishi plate to gain more volume so we can actually put the implants in. But if we do that and we go through the 2 lots of surgery and the 6 months, 8 months of healing to do that, and then you've got no back teeth to support that, you have to be ready that that's going to fail. I just don't think that's a good idea. So she said, okay, well, what do we do about the back teeth? And I said, well, you know, we can work on the back teeth, but then there's no bone at the back, so you're going to need a sinus lift. Okay, so all of a sudden this situation has turned from I want to get my front teeth sorted out, her thinking, look, it's one surgery. I'm now saying you need a big graft at the front, you need a big graft at the back, and then we'll put the implants in. And this is now going to be more like a 15 to 18 month case, because those grafts are going to need at least 6 to 9 months to heal. But there's an alternative option here where we can place implants and build a bridge that gives you everything that you want. It gives you the security. It'll be stronger because the 4 implants will be linked together. There's a cost issue because obviously the cost of doing this treatment will be slightly more than you anticipated. But from a long-term perspective, I think this is a good option. And we put 4 implants in. The actual surgery took just a couple of hours. The whole treatment, start to finish, was about 4 months. And Julie has gone from this situation into this situation. Okay, and I think it's a fantastic result. She was over the moon with it. The lab work, as usual, done by our lab, and she's going to be able to function really well, securely. She's got a smile back. She can eat what she wants, and it was complicated from a planning perspective, but once we all got the go-ahead, and it was fairly straightforward. So yeah, you get these cases, good to discuss, good to be open with the patient, and think long term, think about what's going to be there in 10, 12 years, what problems you're going to have. You know, if you're putting implants in anteriorly, always think about the back teeth. Big issues. You know, if you're a patient or even if you're a surgeon, really good to think about the back teeth are what keep the front ones working longer. Okay, thank you.